definitions. The heart is basically a pump, and heart failure generally refers to the fact that the heart is not pumping blood adequately around the body. So if the heart as a pump is not pumping blood to the vital organs, and the blood backs up and causes some congestion in the lungs, that's the most common definition of heart failure. Heart failure can be a progressive disorder, but it depends on the cause. It depends on the etiology or what has caused a heart failure. So patients can get heart failure that's completely reversible. For instance, heart failure can be caused by a viral infection, and oftentimes after the virus or after the infection resolves, heart function can return to normal. There's a condition of postpartum cardiomyopathy, which is the heart getting weak after a woman gives birth. And that condition oftentimes can go back towards normal heart function. Congestive heart failure in the United States currently affects approximately 5 million people. And so it is something that is one of the areas of cardiology that's actually increasing as opposed to decreasing. Some of that may have to do with the fact that we're all living longer, and we have techniques now to save people from heart attacks that they've died from in the past, but sometimes that leaves a patient with some weakening of the heart and can lead to the development of heart failure. Heart failure and a heart attack are two different things. A heart attack is typically defined as some damage done to the heart muscle related to an artery being blocked. That piece of the heart muscle which is now not getting the blood and not getting the oxygen, not getting the nutrients it needs, can die, and that when that happens we call that a heart attack, or at the process of that happening we call it a heart attack. Heart failure, on the other hand, can be the result of the heart attack, where now the heart is left in a damaged condition. The muscle is now weaker, no longer able to pump the blood for it as efficiently. But heart failure can also happen in somebody who, for instance, has a heart valve problem, a leaky valve, without having had a heart attack. That can cause the heart to work extra hard over time. The heart can enlarge, making the leakage worse, and can again lead to heart failure. Heart failure can affect both the left and the right side of the heart. The left side of the heart is typically what is most noteworthy in the beginning. It is the main pumping chamber of the heart. It is the chamber of the heart that pumps the blood to the vital organs in the body. But if you will, the most common reason for the right side of the heart to fail is because of the left side of the heart failing. When the left side of the heart fails and doesn't pump the blood adequately, the blood can then back up and cause an increase in pressure in the lungs. The purpose of the right side of the heart is to pump the blood into the lungs. So now the pressure is higher and the right ventricle is now not able to pump the blood forward into the lungs as efficiently, and as a consequence it can then back up further and cause fluid retention that we might see as evidenced by swelling of the abdomen or swelling of the feet and legs.